More than happy for that, more so now that my camera's off as well. I'm in desperate need of a haircut, so yeah, that's absolutely fine to record it, no problem.
Yeah, Amy just suggested that. I thought it might be quite good for everyone that couldn't be here today, and we can share that. We're not having to repeat ourselves. So I'm just going to share screen, and then we'll talk through a little bit about what a digital health hub is, and kind of principles and fundamentals. And I'm really excited about the prospect of being able to use this model in this area to achieve the outcomes that we all want to. And then I'll introduce Sam from Crossgates Good Neighbours, who's going to talk a little bit about how we've developed the digital health hub in Crossgates Good Neighbours and how it's been running through the pandemic. So thinking about some of those challenges of being able to adapt the model to the current situation as well, because we developed it pre-COVID when we could sit around a table with a cup of tea, which is a distant memory now. Right, I'll just share screen. Give me a second. There we go. So just starting with what a digital health hub is. So just to give you a bit of background. Oh, can everybody see okay? Sorry. Just to give you a bit of background. We developed the first digital health hub last year in Leeds. We'd been offered the kind of opportunity to develop it. We didn't really know what a digital health hub at that point was. All we knew that it was something specifically to support people with their health and well-being and support them to overcome barriers to digital inclusion. So we liked the sound of it. And it was very much a test and learn project to really see, you know, what this could look like, what it feels like, and the real true kind of key benefits it could have for the people in that area. So we started developing this model with Sam at Crossgates Good Neighbours. She started just the week of the launch and has been in post up 18 months now, still developing the digital health hub way past its project end date. So it's very sustainable and still continuing through the pandemic, and that's a real credit to Sam and the team. So really looking at kind of what is a digital health hub. Obviously back then we didn't know, now we do. So really thinking about, you know, what are the key principles. So a digital health hub is a community location, an organisation with trusted people who can support people that are socially or digitally excluded. So you might be thinking already, well, that could be our organisation now, that could be our service, and that's very much the feel of a digital health hub. It's not recreating something new. It's harnessing what's already existing in the community and kind of piggybacking on that with the kind of principles of really supporting people with their digital skills to improve their health and well-being. So it's very much about bringing digital and health together. I'm sure most of your organisations' ideal outcomes is to support people with their health and well-being, maybe in a wider well-being sense. So what this does is really kind of drum down and really support people to really be able to access healthcare digitally and really think about what those barriers are that are stopping them from doing that and being able to do that going forward in the hub, in the digital health hub, or with the support of the digital health hub. It's very important to note that digital health hubs take a holistic approach. So it's not just an extension of like a GP practice. So it's not just everything you can get in a GP practice or in a healthcare setting you can get here now. So it's not about replicating kind of healthcare or moving it or shifting it somewhere else in the community. It's about partnering, so it's a joined approach. So it's bringing those existing health and care services in partnership with those local community organisations to be able to support that person, to be able to access both through that support of the hub. The main key fundamentals, so we talk about kind of supporting them to improve their health and well-being through digital. What does that mean? So managing the health and well-being online, so accessing health information potentially, accessing the actual digital health services, so the actual transactions. I know we mentioned a little bit earlier, you know, about video consultations, ordering prescriptions, making those appointments, those actual transactions that we do or can do or could do, should I say, people can't at the moment, digitally. And then kind of finally, sort of the core really, developing their digital skills and confidence to overcome those digital inclusion barriers. So in that, thinking about, you know, these places, it might not be kind of branded, you know, come here, we'll help you with your video consultation, because we know people that are, you know, have low digital skills, are digitally excluded, have barriers to digital inclusion, whether it be confidence, you know, motivation for the most part, language, have specific needs. The first thing they do online is not going to potentially be ordering a prescription. So it's really thinking about, what like sort of we've been talking about today with Sam, thinking about how we support people to have those basic digital skills so they're more confident and able to then be able to engage in digital healthcare, either independently or with support in the hub itself. So that's kind of definition of what a hub is. We shared a document prior to the meeting. I know Neil at Cozy has sent it round, and that was kind of what we classed as our principles of a digital health hub, and it was quite a lot of information in that document. So you may or may not have a chance to kind of get through that, but what I've tried to do in here is just simplify that. So that was the principles of a digital health hub through the lens of Crossgate's Good Neighbours. So that's all we knew at that point. But I really wanted to stress, whether it's sort of respect to this project, these are kind of the key fundamentals, but everything outside of this is bespoke. So every digital health hub in the country, ideally going forward in the city when we have developed more, will look and feel different. The key principles will be the same, the key ideal outcomes will be the same, but the actual look and feel of it will be different. So it's based on your capacity, your resource, the needs of your service users, the demographics that you're working with, potentially the actual location of the building or the organisation itself. So all that's very much transferable and changeable based on the kind of bespoke model of a digital health hub. So it's about working with your organisation or group, not kind of forcing a model onto it and trying to make it fit. So these are the core principles that do sit within every digital health hub that do kind of sort of form the foundation. So firstly, really thinking about the trust and relationships. So it's a community organisation or a location that has existing trust and relationships with people. It's somewhere where people feel safe. It's got that kind of all welcome attitude, inclusive, and being able to reach people who might not feel comfortable in other settings. So thinking about the barriers where people might not be accessing healthcare right now, potentially because of their culture or motivation or their previous experiences, and maybe not feeling comfortable in actually healthcare buildings or speaking to people they don't know. So actually bringing some of that comfort and familiarity and harnessing that with the people that they do know and that they've got existing relationships with. So thinking about you and your organisation being the best place for that person, or being able to signpost people to the best place for them where they already have those existing relationships. The model is very much about building local partnerships. So as I said, it's a very joined up approach. So it's not about one digital health hub potentially working in silo. Sam sort of will talk a little bit about how it works at Crossgates in a moment, but that real kind of bridge and partnership with their local health and care services. As we've developed the model, we're really keen now, as well as that, to kind of have that joined up approach with the local community organisations as well. So that greater understanding of service offers. So the digital health hub's very aware of what else is on offer outside of their hub, and likewise health and care are very much aware of what's available to support for people in the hub and existing community organisations in the area. So it's very much a joined up approach, and that person that's engaging in potentially one or multiple services is able to have that information about the local assets in their community. It's about referring and signposting, so that healthcare services are able to refer. So if somebody is accessing healthcare and at the moment that's not accessible for them because it's not in their first language, or they haven't got the digital skills to have that video appointment, so at that point it's a no for them. We'll have a telephone appointment. Actually, it's about them being able to refer them to a digital health hub so that can be turned around. It might not be a no next time, because if they have that holistic approach in the digital health hub, support to grow confidence, skills, overcome some of those barriers that they do have, and it might be access, it might be they just don't have Wi-Fi or a device that doesn't have strong enough Wi-Fi or whatever, like we've been talking about. That next time or when they do want to engage with kind of an appointment or transaction with the healthcare, they are able to, because of that support in the hub. Opening up new possibilities and opportunities. So thinking about organisations and staff being able to have a greater understanding of actually what's available for people. We did a session last week, didn't we, Sam, with some of the neighbourhood networks, and actually it was a really good question. It was thinking, well, do we know what's even available for people to support them with their health and well-being? We might not. So actually thinking about the digital health hub, actually being able to know that, and your staff teams having that confidence and an understanding of what is available for people, the better support their health and well-being. It might be to support them to access it, it might just be to tell them about it, and inform them about what's available so they can access that independently potentially. It's about enhancing and expanding your current offer. So it's like I say, very much moulding it with your organisation, looking at what your offer is currently and how some of this could be embedded, possibly is already embedded. Some of this might already exist in your organisation as a digital health hub. And then finally, as I mentioned, the principle of digital health hub, the idea of it being in a community organisation or community location above any other place is because it has that potential to have that holistic approach. You know, that kind of whatever is important to you is important to us. So thinking about, you know, responding to immediate needs. So first thing that somebody might engage with might not be healthcare, but it might be the third or fourth thing once their confidence developed. It might be the first thing, because if that's the real thing that they want to do that they can't do, it's responding to that need, if possible, with resource and capacity to be able to enable people to access that particular transaction through the support of a trusted relationship or somewhere they actually just feel more comfortable. When we talk about kind of supporting people to engage with healthcare digitally, I just wanted to kind of set out what that looks like and what that means, because we found that when we developed the Digital Health Hub, it was very much kind of, yeah, actually, we're supporting people with their healthcare digitally, like what does that entail? Like, what are we actually going to be supporting them with? What is available for people? So I won't go through all this word for word, but you can see sort of categories, and this is kind of how we grouped it with the Digital Health Hubs and found these are the kind of key themes for supporting people with their health and well-being, either signpost them to this or supporting them and guide them through accessing some of this. Firstly, thinking about, you know, finding and navigating reliable information. So we know, I think we talked about it earlier, people actually trusting the systems, trusting the information maybe that they actually have access to. So actually that Digital Health Hub being the place where people gain that confidence and a signpost is the accurate, reliable information in order for them to be able to improve their health and well-being. The transactions, as I mentioned, you know, that whole kind of booking, confirming, interacting with their local and community healthcare services, apps and websites. So we know that there's lots and lots and lots of health and wellbeing apps out there, but actually which ones are trusted. So finding that trusted ones that would really benefit people actually understanding and knowing about them, knowing how to access them, knowing what the key benefits could be for them. You know, thinking if they've got a long-term condition, what app would really benefit them to stop them from having repeat hospital admissions or regularly attending their GP for particular kind of sort of bad points within their managing their condition and improve self-management. And also kind of what websites and tools and resources are available already for people. We really want to kind of raise that awareness so people know what is available for them. And then finally, obviously not just all transactions and resources, but a lot around social interactions. So actually peer support groups, online local health and wellbeing support, and those kind of Zoom sessions, those kind of wider wellbeing sessions that are available to people, either running those within the hub or being able to signpost people to what is available to be able to support their wider mental wellbeing maybe. And then just finally, I just wanted to talk a little about the benefits. So obviously we know now kind of what it is, and we know the principles of Digital Health Hub, but what are the benefits for people? So obviously we want to expand this, we want to develop this in this footprint, and this is the reasons why really. So when we're looking at the project, we know what our ideal outcomes are. You know, we want people to be digitally included, to have those wider access to health and well-being. We want them to be able to improve their health and well-being, improve self-management. So this is the benefit of the Digital Health, and we felt like really aligned with the outcomes we want to achieve through the project. So again, won't go sort of read them all out, but you can see the kind of key main themes: having access to Wi-Fi and equipment, maybe physically, you know, through the actual buildings themselves, maybe being able to lend equipment out potentially as a resource, having that support, that digital support to be able to increase their skills and confidence, safe space to maybe actually have the transaction, and reducing that loneliness, and in the most part really that greater awareness of their local community and assets. So that real joined up approach, and that it's really not just a sort of hub working in a silo, it's very much joined up with its local services and healthcare. And then just the benefits for your organisations and your services, and again Sam can probably advocate a lot of these being a digital health hub within an organisation, that increase staff skills and confidence, that improves signposting, increase in resources, that wider reach, and that kind of those service users and patients that you're working with and engaging with have that increased digital skills and confidence. and possibly improved health and wellbeing, to be able to interact with your service and multiple services outside of the hub. So that's the kind of key benefits for organisations and services. And I just wanted to finish before I hand over to Sam, just on impact. This is just a quote from someone that has that interactive and access to Health Hub, and I just think it's a real good way of summarising the benefits it can have for people. So thinking about someone that hasn't got access to a digital Health Hub at the minute, and potentially is coming up against the blockers and barriers that we've mentioned earlier, and actually the hub being able to turn that around and provide the benefits that that person can then actually access healthcare in a really accessible, inclusive way that's really, really comfortable and supportive and safe for them. So that's the general kind of picture on digital health hubs. I'll just hand over to Sam, and Sam is going to talk a little bit about how Crossgates with Neighbours developed their digital health hub and how they're continuing that through the pandemic, just to give us a real life sort of example of it on the ground. So yeah, thank you. Sam, I'll let you hand over.
Thank you, Rachel. I'm just going to go in and share my screen. I've just got a few slides to go through. Okay. So so thank you for that, Rachel. Some of you, you've covered quite a lot there, which is fantastic. Some of it may be in this, but I won't duplicate if I think you've already mentioned it as well, Rachel, but we'll see how we get on. So as Rachel said, we put in for funding, I think it's around late summer 2019. And what Crossgates and District Good Neighbours recognised was that a lot of our members were being left behind in IT. Everything is moving online, particularly around prescriptions, doctor's appointments, and they could tell that people were really struggling with this. So they decided that they'd partner up with 100% Digital Leeds, and we'd become this digital health hub. And then I was employed to take this role on. And as Rachel has said, we didn't know at that stage what a digital health hub looks like. It's been developed throughout the last year. We had 6 months pre-pandemic, which was fantastic, and the last however many months has been in this lockdown. So we've had to really adapt as we've gone along. So we were successful in funding. I think it was around September 2019, around that time. And the very first thing that we did was we did a digital launch event in our centre, really to tell our members that this is where we were going, that the centre was going to be launching digital across the board, across all of our activities. We had 150 members turned up. They all had lunch with us. A couple of councillors came along, and we got Lloyds Bank on board as well, because they've got their don't know if they're called digital eagles, that might be Barclays, but they do have volunteers that do support events. If you ever needed their help, they will come along to any event. We put 77 questionnaires. We gave questionnaires out at the event. 77 were returned. 49 wanted help, so that's obviously well over 50% of those, and replicated across all our members. I think there must be at least 70% of our members that need some form of digital health. We've got 1,200 members at Crossgates Good Neighbours, so I think it's extremely high, the numbers that need some support with digital. Some no skills, some low skills, and some just need a bit of support just to do one or two things, and then they're fine. So we did the launch, but at the same time we were also planning our digital health hub. Rachel came along and did some digital champion training for us. This is just some of us receiving our certificates from Rachel to become digital champions. And this is about training your staff and volunteers to have those positive conversations with your members around digital, and just encourage them to have a go. We also formed our tech team. I joke with Rachel on every picture, because every picture of me has got a different hairstyle. So yeah, so I'm really different in every picture. It's become a bit of a standing joke really, over this lockdown, with all the lockdown hairstyles. But anyway, we formed our tech team. So these are my 3 digital champions. Harold's 85, Rob and Joe are both in their 70s. So Harold at 85, our oldest volunteer, and has done a fantastic job doing some one-to-one support with us. So it's great having them on board. We looked at how we would embed technology in our sessions. So we got the iPads and tablets out that we'd receive funding for, some of which had come from 100% digital Leeds, put them out on the tables and just encourage people to have a go. And we also have a Friday afternoon session that we were running at that time as well, that we relaunched. So as I mentioned, here's some photos that we're embedding digital across all of our activities. Maybe like yourself, we've got coffee mornings, we've got our Live Well Cafe, we've got Dementia Cafe. So we got the iPads out across all of these sessions. For members that were new, we kind of did this to kind of reduce that fear. So we'd get them out and put games on and let them have games on there. We also encourage social side, because if we got a tablet out in a session, it can be quite isolating, and we didn't want that conversation to stop. So we encourage social games, so like 2-player games or looking at photos together to keep people chatting with each other. We also chatted to members, listened to any concerns around using digital, and took that on board as well. And then these are just some of the photos. The one in the middle and the one on the right are our Friday afternoon sessions where we did one-to-one support for people there. Just a digital drop-in, that is, on a Friday afternoon. We knew we had a big task because of the service. We had a lot of people, beginners. We do have a lot of people to train, so we knew we've got quite a big task ahead of us. But in terms of becoming a digital health hub and what we do, some of these, Rachel, you might have touched on, but I've just listed some of the things that we've helped people over the time that we've been doing it. So a big thing, one of our big targets or big things was to get people to use the NHS app or the doctor's appointment online to book the prescriptions and manage their appointments. And we used to run one session a week in our centre on a Friday to do this. We'd get 5 or 6 people in, we'd send them off to the doctors the week before, or they'd ring the doctors, because you have to get a letter with your passwords on to be able to be set up to access this online. So they'd go and do that, and then they'd come in and we'd all work with them to get them set up and show them how to use the app and how to do the prescriptions. That's the same with the NHS website. If any of you have not been on the NHS website, we really do promote that to members as that trusted resource. We don't want them Googling and going off to weird and wonderful health websites. We always push them to the NHS website. There's loads of things on there about managing conditions, managing the conditions. There's an A to Z on medication, lots of information. So we do use that a lot with them. Again, somebody mentioned Learn My Way. We use that for teaching members to help them improve their digital skills. And we'll be using that alongside these videos that I mentioned that I'm creating as well. We've helped people renew bus passes, e-hit cards. You can tell I put that on pre-pandemic. That was when we had people travelling and wanted to update the e-hit cards. Medical wristbands, we've ordered a few of those, and research equipment online as well, maybe for our visually impaired members, keyboards, different things like that. Obviously still increasing the digital skills all the time. We've done some work on fraud and scam prevention. The photo on the left, you can see the police officer there. She came in on one of our sessions, and this was around online safety. It kind of looks odd now seeing people sat together, but that's some of the sessions that we've done, and further sessions here. And we borrowed some virtual reality headsets off Rachel as well. I think that's Ernest, he's 94, Ernest, and we put him on a roller coaster, bless him, which was quite good. And that's why he's clinging onto his chair there, so he doesn't fall off his seat while he's on the roller coaster. But yeah, and we've always run weekly computer classes, which we've tried to keep going throughout the pandemic when lockdown rules eased, and we're doing it online at the moment as well. So some of the ingredients of a digital health hub, as I say, Rachel, you might have touched on these. And for us, it was that familiar environment, Having the right IT equipment and good Wi-Fi has been mentioned. We've actually just upgraded our Wi-Fi in our centre this week. It's actually cost the same, but Virgin have brought the fibre into the building because our Wi-Fi was so slow. But they've done it for the same price, which is fantastic. You need dedicated staff and volunteers to help run the service. Again, Rachel's mentioned some of these: knowledge of arts, motivation. We've done a lot of partnership working in the local area. Myself and Rachel have been out to, I think, nearly all of our doctors' surgeries now. And I know, Rachel, you've done some presentations with them, and we spoke about referring into us, which has been really good in getting out there. Knowing how to have conversations and positive conversations with members about health management, getting that I can do it attitude. Again, I kind of find that, and somebody mentioned it here, that their family can quite often not have the confidence of our older people. Their sons or daughters will say, "Oh, Dad, you're too old to learn this now, I'll do it for you." We have a lot of that to kind of overcome, that people have kind of take that confidence away. And I think some of it is about, I think somebody mentioned, them just maybe not having the time or skills to teach them. So they kind of block it before they even get there, which is a shame. So it's kind of saying it's not too late to learn. Ernest, our 95-year-old, is 94, he's 95 next. He's been on, I think, 150 Zoom activities. We're hoping to get him in the newspaper next week because he's our "you're never too old to learn" guy, is Ernest. So we're hoping he'll be in the newspaper next week. We're just working on that. And yeah, a relaxing place to learn and tailor the support to your members as well. This was me teaching in lockdown at a social distance with our screen and our long stick, so we stayed behind them pointing at their device. So yeah, lastly, the support through lockdown, we've kept what we can going virtually. The first thing we did was I trained about 60 to 70 members on Zoom over the telephone, and then we put on our virtual groups, some of which are on this picture on the left-hand side. And they're still running now. We've got a programme running 5 days a week of virtual activities. This afternoon, there'll be 10 or 12 of them playing bingo. Thursday morning, we do IT. We've got quiz on a Friday. Tuesday, we've just started a book club. And all of this, although you might think, well, is that to do with health? But it's for these people, it's really improved their mental health. That's been a huge issue, as you know, isolation through lockdown. And actually friendships are made across the screen of people coming on these calls. They've got to know each other a lot better. So that's been a really big plus. So yeah, we've continued our online IT lessons. We've set them up on Learn My Way to learn from home, and they'll come on and do screen share, or I'll share my screen with them to teach them things. We have just launched our, well, I launched it, I think it was about October, when we received funding to become a digital health hub for the second year. And obviously we've got to do it virtually now. So I launched this Staying Healthy or Keeping Healthy at Home course, which we hope to run in centre at some point as part of our digital health hub. And that's 4 weeks long. It was just an hour a week, and each week we focused on a different activity. So it might have been around healthy eating. We covered accessing exercise classes online. So that was like through YouTube, how to access and use YouTube, how to use the NHS website, the Leeds Active website, because they've got exercise classes on there. We did online safety as part of that. And we also did the NHS website and booking doctor's appointments online as well. So quite a lot in there that we've covered. And then, yeah, just briefly, just some of the impacts on members that Rachel's touched on. That we've got one of our members he couldn't never get through on the phone to the doctor's surgery. So he used to go down at 8 o'clock and queue to try and get an appointment for his wife because you're always in the queue. So now he can book online. That's saved him a lot of time and hassle. Many are ordering prescriptions online as a result of the NHS app work we've done. We had one of our members, Sylvia, she borrowed a tablet, because she needs to access a physio appointment online. She was doing it on a really small phone screen, so the tablets made a difference to her. We've got them joining in the exercise classes. For anybody who might have heard of Your Backyard, they've been doing exercise classes this last month. So we've had them all on there. Well, not all, we've had a group on there doing that. We also joined up with Ministry of Food, and we did a 6-week cooking class with them around healthy eating. So members, it was about 8 or 9 did that every week, which was really good. And you can cook along. They give you all the recipes. Again, mental health has improved. With members now video call friends and family because they've gained confidence using Zoom. And if they want to do the doctor's appointments, now they've got confidence on Zoom and video calls. It makes it a lot easier for them. And again, yeah, just using the NHS website to access information, that's been a benefit to people as well. So that's a fast run through of our digital health hub. But we're just really continuing to develop it, doing what we can in lockdown, and just waiting for the time we can reopen and try and get more of this done in centre as well. So yeah, that's a bit about us. I mentioned some of the solutions to the training that earlier that we've come up with. Just quickly in terms of our tablets, to make it affordable and sustainable, we actually do a rent out scheme with our tablets now. We rent the tablets out at £5 a month. But what we say is if they've rented it out, then if they want to buy it at the end of say 10 or 12 months, we'll knock that money off the amount of the tablet and they can then purchase it from us. That's what we do. But we do have, for the Wi-Fi, we are at a stage now where we have to rent out the Wi-Fi. So we put them a SIM card in, and we charge, I believe it's £10 a month. But that means they don't have to go into a 1 or 2 year BT contract or whoever it is, and then decide in 3 months' time Wi-Fi is not for them. But what we hope is they'll rent it from us for a few months, and then we can maybe get them onto something more permanent if they want to stay, because it's not a permanent solution renting Wi-Fi from us. So then they can look at other options with their telephone provider. But yeah, we've had lots of challenges, lots of barriers, and we're still working. I mean, it has been fantastic, the amount of people that, and the stories as well that come out of it. And it's just continuing to work with that and develop things that we can help with them as well. So yeah, hope that's been useful. And so I'll hand back to you, Neil, before I talk too much.
Sam, I could have listened to it for a lot longer as well. I mean, just from my perspective, as I mentioned earlier on in the meeting, we've obviously been kind of meeting as a smaller core development group, kind of in that intervening period between the green light of this project and then things kind of stalling in terms of the funding. So there's been obviously a lot of discussions really, but that has just really kind of brought it to life for me, and I hope it has for other partners as well, really. Just seeing some of those stories and kind of hearing how you've gone about it, and really starting from nothing and developing something from there is it's been absolutely brilliant to hear that. So thanks very much for coming along today. Is there any questions from people? I'm mindful of the fact that we've got 10 minutes left. We were going to break out into some discussions around digital health hubs and kind of partner perspectives on what you kind of what your kind of feelings are around the concept and around the model and what might work for you. I think really though, I think we would be happy to kind of. I just think that's teed things up perfectly, really, and maybe we revisit that at a later time. Is there any questions for Sam? Just while we're on here. My only question was that if you're one of the guys that you work with, Ernest, if he's such a prolific Zoom call attendee, then he's more than welcome to come to one of these in the future and kind of his experiences. He's absolutely more than welcome.
He's a lovely guy.
I think the objective here today was to kind of understand from your perspective what kind of are those common issues for residents, common issues in terms of service provision in terms of digital as well, and then introduce the concept of digital health hubs and what that might mean and what that might look like in terms of this project. And I think it feels like to me that has really been delivered. We did have a couple of kind of prompts or questions that we'd set out in terms of the discussions in the breakout rooms that we were going to break out to. I still would like people to really reflect on what just on the concept of a digital health hub, what it means in terms of your own organisation and kind of working in partnership as maybe a community of organisations in order to, as I say, to deliver on the brief for the project. So Amy, Rach, and just kind of thinking off the cuff here, I'm just wondering whether how best you think to go about that. Should we just kind of send out maybe a document for people to add their insights and reflections to, or would you like to set up another session maybe to have a bit more of a chat about this? Happy to be led by you guys.
I don't know what you think, Rich. I'm not sure. I think that it's great that we've recorded the session, because I think there are lots of people that haven't been able to make it today that will get a lot out of hearing Sam and Rachel speak. I mean, one of the things, sort of jumping ahead slightly, one of the things that I was going to mention really briefly is that we're going to run a grant scheme for Beeston and Middleton area to support just a small one, to support organisations that might want to implement some of these elements of digital health hubs that might, be lacking resource or whatever. So that funding sort of process isn't in place yet. So I wonder whether we send out the video and the information that we done today, Neil, and then get together again to have some of those discussions that you're talking about, and also to talk about how the funding might be used, maybe. Again, just thinking off the top of my head.
How does that sound to everyone? That sounds like a good plan to me. Because there's a lot of information, but a lot of really inspiring information there. So if we kind of consolidate what we've done so far, send out a link to the recording of that, ask people to reflect, and then pull together another group for a bit more of a detailed discussion. Okay, brilliant. Okie doke. Is there any other Oh, Rach, sorry, Amy.
So yeah, well, I mean, was you going to say any other business?
Yep.
I might have jumped the gun here.
That's exactly what I was going to say.
Good, good, because it's not a reflection on this. So, so with this in mind, so linked to this, one of the things that we have heard from organisations looking to support their members to be able to do more digital health stuff is that lack of confidence in staff and volunteers knowing what platforms are being used for video consultations and how to use those platforms, and so they've got the skills themselves to be able to talk someone else through that. So with that in mind, we've been talking to Leeds Community Healthcare, LCH, and about how we might be able to work more closely, because obviously they're very invested in you guys being able to support people to be able to use their system just as much as you are in being able to have those skills. So they have really kindly opened up some of their staff some of their staff training that they're running at the moment for their staff on how to use Microsoft Teams and how to use AccuRx. So that is available for booking. So I'll really quickly share my screen and show you. Oh gosh, where's my form now? Hang on.
So just for context as well, that AccuRx is it's an online consultation platform, which is basically that digital link between a person and healthcare service, whether it's general practice or the neighbourhood team from LCH.
Right, sorry.
I think as well, just while Amy's just looking for those bits and bobs there, I think for context as well, is those kind of platforms I think will become even more important. One, basically the kind of a forethought to essentially the backlog, really, in terms of appointments and in terms of missed appointments, and we know that is going to be on the horizon, and that's something that's going to be with us for the next couple of years, we would say. So yeah, I think platforms like that are going to be really kind of harnessed to kind of help with that. So any kind of learning would be really useful.
So yeah, so these are the sessions that have been made available. So I'll put the link in the chat. We've just done a really simple form. All we need from people is your organisation, name of the attendee, the role, the email address, contact number, and then whichever sessions you want to attend. And you can attend as many as you want, and you can sign up as many people as you want. And then the invitations will come from LCH. This is what they've offered us based on what they've already got. We see that they're all on a Thursday morning, which might not be ideal for people. So also any feedback that people have got on that. The other thing to say is, I haven't attended any of these trainings or anything, but I'm going to try and attend the first one on Thursday so that we'll get an idea of exactly what we're offering to people here. But if you would like some free training alongside health professionals, I think is a really good point as well. And we're really keen to, and LCH are really keen to hear the voices of patients and your members, and really value, you know, hearing your experiences and the sort of barriers that people are up against and stuff like that as part of this. So I think the idea of being trained alongside those health professionals and seeing what some of those processes are, as well as just how to use the system, could be really exciting. So if anybody wants to sign up to that, and again, we'll share that in the minutes with the wider local care partnership as well. Is that okay? So hopefully that's the kind of thing that we'd like to try and facilitate as well with some of the other health and care providers, to try and get that closer working and an open two-way dialogue between the local organisations and the health and care providers, so that we're all working together to try and make things as accessible for people as possible. So it's not just about you guys showing people what to do, it's also about the health and care providers listening to where the sticking points are, where people keep getting, you know, issues, so that they can sort of build accessibility into their systems as well going forward. Like little things like, I know we're running out of time, but just as a little anecdote, was talking to an organisation the other day, I can't remember who it was, that was talking about working with homeless people, and one of the systems having a field for postcode that you had to fill in to be able to move past, and there's no reason for that having to be filled in apart from the way the form was set up. So they'd organised a workaround where they put a made up postcode in there that got around the system because someone has got no fixed address, whereas we can feed that back to the people who design the systems and say, this is a sticking point, we shouldn't be having to design these weird and wonderful workarounds if it's something as easy as just turning off a bit on a form that forces people to fill in stuff. So those are the little kinds of changes that hopefully we'll be able to make. That's it from me.
Brilliant. Thanks, everyone. Is there any other comments, questions, queries? Mindful of time. I think Daniel's just had to dip out, unfortunately. Amy, I think, so was that the link to, Amy's just shared the link to the form relating to the training with LCH. As Rach and Amy have mentioned, we're making links with the other provider organisations as well to really kind of bring all of this together. We've highlighted in previous meetings, and you guys have reflected on this as well, is that obviously for maybe the people that lean on the health and care services the most tend to tend to be engaged with lots of different services. So obviously a need to be able to access general practice, a need to be able to access services in terms of social care, the community neighbourhood teams. So just making sure that we've got that breadth of knowledge really about how do people access these services digitally, and making sure that we provide the right support for them. So we're on with that process at the moment. So just to kind of consolidate, I think there's Dan is going to be picking up an action regarding some of the intelligence around connection issues that Council of Trust will have introduced. We've mentioned about supporting people remotely and being able to, well, yeah, exactly that, supporting people remotely in terms of skills and confidence. And Rach, Amy and Sam have mentioned that there's the possibility to pull some sort of support there for you guys. And also just to link back to the bidding opportunity, I think this, in the conversations that we've had, either there's a wider LCP where the digital inclusion has been an item, or in a couple of the working groups, that kind of trust, security, attitudes to people using digital seems to be that foundation really. So if people have got, if people see the value of maybe coming together around a potential bid around e-safety, then that would seem really logical. So if anybody's if anyone would like that, then we'll put the offer out there along with the minutes and summary of this session, and then we can get cracking with that. So I think I'd just like to thank everyone for dialing in. Thank everyone for the contributions. Bit of a smaller group than was planned, but as I say, I think that is because of some of the pressures on partners from statutory services. But it's been a really valuable session. As always, if you need anything, just contact myself, Amy, Rach, Akosia, and any of the guys on that small development core group. Just let us know. Okay, everyone, we'll draw it to a close. Thanks everyone for dialing in, and take care. Sam, thanks again for your presentation.
Thanks, Sam. Thanks, everyone. See you
Thank you.
Bye. See you later.
Bye.
Bye.
Bye.